It's a little difficult to stand on a stage where such illustrious speakers have spoken before me. And I would really like to thank all of them, Dr. Rajiv, Dr. Gupte, Dr. Uh, Air Vice Marshal Kapoor, for shining the spotlight on technology. And I'll talk more about why that becomes a differentiating factor for most hospitals in this part of the world. I'm also very honored to be with a lot of young people. Uh, I like to take more energy from the audience, and so I hope to go back from here younger. The biggest challenge in healthcare today is accessibility. But like they say, accessibility to healthcare requires you to be in a strong position yourself as a healthcare provider. This is similar to the warning that you get in an aircraft as the flight takes off. It says in case of oxygens or depressurization, you have to put on the mask on yourself first before you give it to the others. In the same manner, I would like to argue today, in the same manner, what I'd like to argue today is healthcare institutions, providers must have a sustainable business model and be able to make money for themselves before they can look forward to creating accessibility in the community. This accessibility becomes very important considering the fact that for most policy planners or for owners or for stake hospitals, if you have 100 beds, there is a theoretical maximum amount of revenue you can generate. At full capacity, there's only so much of revenue that you can make. So then how do you make you more sustainable in the face of declining margins, increasing pressure, and of all the things in the world in increasing consumerization, where the relationship between increasingly getting fractured and there is a trust deficient that is creeping in. Maybe this is a better one. How do you mix all of this and yet think of making yourself sustainable? And that's what I would like to leave you today with a few thoughts. My focus today is to say that you must focus on revenue. You must focus on technology as a competitive differentiator for yourself. And hopefully you'll be convinced at the end of all of this that if you are financially in a strong position, if the provider is in a strong position, they are therefore automatically in a better position to deliver more value to the community. Whether you be profit, not-for-profit, non-profit, or commercial or public sector provider, it does not matter. You have to be sustainable in the form in which you deliver your services, and that's what is my argument all about today. Can I get some water? So my point is, let's start thinking revenue and stop thinking of technology as a cost or as a necessary evil. That's what I'd like to leave you with a thought today. So what are the challenges that hospitals face today? There is a growth. Obviously, there are a lot of patients, there is a lot of people who require healthcare. How do you address growth in the way that you deliver value as well? You have to look at increased revenues, but at the same time, you have to also look at reducing your cost. Because today, while it is true, certainly, and as our chief guest pointed out, India does have a lot of people. 1.3 billion is nothing to scoff at. But do we have the right level of skills? And one of the problems I always see, for example, is in nursing care. I think our nurses in India have the opportunity to do a much higher level of skill of delivery. This is what I see in places like Singapore, in places like Australia, in US, and the other parts of the developed world, where a nurse is not someone who's just looking at providing basic services, but a much higher level of skilled services. There are nurse clinicians. They are not just people providing nursing care services. Finally, it's all about retaining staff. If you're able to give them a work that interests them, that does not make them do routine, mundane work, they will obviously also be there with you for a longer period of time. So how do you meet these challenges? Where do I point this? Okay. So how do you meet these challenges? Obviously, a lot of hospitals use technology for maintaining their cost and making sure that they have traceability in their books, for ensuring operational efficiency and so on and so forth. And they're looking to automate basic and repetitive tasks. But is that the value of technology? My point is it is not. You can do a lot more with technology. No? Okay. You can do a lot more with technology. For example, if you were to look at the percentage of revenue that a hospital is investing in its IT infrastructure and compare it with similar services organizations like an airline or a bank, look at the huge differential. We are talking of 0.5%, whereas in comparison, the others like a bank is at 7%, and airline is 4.39, and I'm told manufacturing is about 8 or 9%. So why is this big gap in thinking? Why is it that hospitals, hospital stakeholders, management not looking at IT as a technology differentiator and merely as a cost containment opportunity that they want to invest in? I would say stop. Stop thinking that this is just a cost for you. Start looking at how would you make more revenue out of this. And start treating technology as a competitive differentiator for yourself. How do you make yourself better? How do you use technology in such a way that people stay and want to work with you, because delivering the tasks that require repetitive, mundane activities are now taken care by automation, and whether it be your nurses, whether it be your allied care staff or the physicians or the other people at the front office or at the back office are now able to do things in a much more value-added manner than just doing repetitive tasks every day. Look at the digital operating system. This is what I like to call it. The hospital must have a digital operating system, right from the point where the patient comes in to the point that the patient leaves. You must be able to offer them an experience that is par excellence, an experience where they want or they can be more involved in their day-to-day care. This is what you want them to be. You want them to take more accountability of their condition. You want them to be more participative in the care process that you are delivering to them. So whether it be, I've shown some examples here. You can do in-room media entertainment screens. You can also use the same channel to deliver educational materials to them. This I have seen in hospitals, and that improves a lot more involvement of the patient in the care process. You can also do smart beds, especially for long-term care. I have seen where you have to do bed turns. How do you do that? How do you look at bed sores? These are all things that can be done using a smart bed. You don't have to necessarily depend on a nursing staff to go and look at it every few minutes or every half an hour or 1 hour or whatever that time is. You can track your ambulance in such a way that before the ambulance reaches the A&E, you are able to keep the care staff ready so that you can have a seamless transfer of the patient from the external environment into your inpatient or your triage environment, so on and so forth. So this is the digital operating system that I want us to consider. A hospital that has completely digitized itself and is able to interact with the stakeholders, both internal and external. So you can do that by the way of care delivery. You could have care plans. You could have clinical pathways. Care plans will help you make sure that there is a consistency in care delivery across your various subunits within the hospital. You also can give a superior patient experience. Patients do want to have a better experience. They don't want to be always waiting to know what's the next step. For example, I have been in hospitals in India where the patient has been told that I will be discharged, and by the time they leave is about 7 to 8 hours. It's a lot of frustration that the patients go through. How do you improve that patient experience? How do you take them on the journey with you so that when they leave, they are extremely satisfied with the interaction that they've had with you? Your own staff. I do agree, and this is something that a lot of hospital administrators tell me, that the cost of the staff is not very high, so instead of one, I can put two. But That's something that I fundamentally disagree with. By putting 2 or 10 people instead of 1 or 2, what you're doing is, yes, you may have probably conquered the cost, but you're introducing a lot more process errors, you're introducing a lot more manual errors, you're also increasing the scope of managing the staff turnover and making sure that their learning is consistent in delivering that service that you want them to do. So I am fundamentally of the opinion that the lesser you use, and the more value-added tasks that your staff is doing, the better it is for the hospital, both in terms of retention, both in terms of quality, and everything else that the patient is looking forward to. Finally, operations management is another area that you need to look at. One thing that I have seen in India is hospitals want only few things to be automated. They want the bill to come out properly. That is the first step. This is what they want out of automation. The second is pharmacy में चोरी नहीं होना चाहिए यार. But बाकी सब कुछ ठीक है. बाकी सब कुछ आप जो कुछ भी कर दो सब ठीक है. Now this is fine from a bottom line perspective, but is this all that you want technology to be serving you for? Technology can do a lot more. Technology can bring you process efficiencies. Instead of doing it in 1 hour or 2 hours or whatever, you can probably do it in 5 or 10 minutes, and that's where you can put that person to do something else in that duration of time. So how do you redefine care delivery? I want us to look at the hospital as a command center that is delivering services across the various functions and sub-functions within the hospital through continuous monitoring of activities of care delivery, of outcomes in care delivery. So you want to make sure that you provide them all the tools and everything else that is needed to deliver that level of care in the fastest possible manner, in the best possible time. But at the same time, you also want to be able, at least for me as the CEO of my organization, I want to make sure that every time something is done, it is repeatable, it is sustainable, and delivers consistent quality to all the stakeholders. That's what I would believe a hospital administrator also wants. Each time a nursing activity is done, each time a physician meets a patient, or each time the front office talks to the next of kin, or the back office is talking to someone, you want the same level of care coordinated and delivered always in a consistent manner. How would then that work? Think of a patient coming into the hospital. I think we spoke of the wearables as a good way of, looking where they are. But today, a lot of hospitals across the world have gone beyond all of that. They use what is known as RTLS, or real-time location services and tracking and so on. So they know at any point in time where is the patient, what is the patient likely to be, so that you don't have any of those issues. And as a patient comes into the hospital, there are facial recognition solutions that actually said that this is the patient. They know there is an appointment that is scheduled for them. Suddenly someone appears and says, I got all of that covered, let's walk you through. So you don't need a patient to be waiting there while they're getting registration done and the vitals taken and all of that. So there's a lot that you can do right in the first experience when the patient enters the hospital. You can also do a lot more by way of big data and analytics and prediction. So one of the use cases that we are working with one of the hospitals in the US and a couple of researchers is, in the case of sepsis, you want to be able to see the onset of sepsis and start the antibiotic treatment right away instead of waiting for far too long. So how do you look at it, and how does the system alert you in such a way that you are able to take that action quickly, because that window of opportunity for you is very little. You don't have all the time in the world for you to take care of it, and that hospital transmitted infection can become dangerous for anyone. So these are some of the things that you can do by way of predictive analytics, big data, or call it whatever you want. But in my view, it is about alerting the people to deliver the right care at the right point in time. We also talk of AI. I think Dr. Gupte was talking of artificial intelligence and blockchain and things like that. So one of the interesting use cases that we have pioneered in Napier is how do I get my stakeholders not to interact with the HIS system that we built. That seems like a strange way of building a system. You don't want your users to be spending time on the system, right? It seems very strange. Why should you want your nurse or your doctor or your billing clerk or your pharmacist or the radiologist spending time typing things into the keyboard and interacting with the system? After all, I built the system. I should gain by more licenses and more revenue. But the fact is this: if I can save the nurse's time from having to click 7 or 8 times into the application, entering data, either it be for vitals or for the bed transfer or whatever, suddenly what I have done is I have unlocked the nurse's time to go and do other value-added tasks. So in one of the time and motion studies that we did for our customers in Singapore, it's a nursing home called Lee Amoy, a nurse could actually save about 15 minutes in each ward rounds. I don't know if you're familiar with the nursing home settings in Singapore and other places. The nurse goes around and takes the blood pressure for the whole ward. It's a batch blood pressure or vitals taking. And when they do that, what they typically were doing previously was they would take the readings, they would write it on a piece of paper, they would go to their computer on wheels and then enter it there. So that process, if I could, for example, put a blood pressure monitor, which was Bluetooth enabled, all that they did was take that and it automatically transmitted it to the application. I went through the ward, and as I went through the ward and each of those readings directly got into the application, suddenly what I have done, I have saved about 10 to 15 minutes for the nurse in one round. Now in Singapore, we have a problem because we are only a country of 5.75 million people, which is 57 lakhs. If you take away the foreigners, that's about 4.2 million, which is 42 lakhs. So there's not a lot of nurses floating around, as you can imagine. So we have to willy-nilly look at how do we improve and increase the productivity of our nursing staff. So those are the kind of things that you want to be looking at. How do I improve the productivity of the people that are there within the four walls of the facility? So in keeping with that philosophy of helping the key stakeholders reduce their interaction with the application, we came up with a unique We came up with a unique solution called the Napier Assistant, which is an artificial intelligence powered virtual assistant. What it does is, before I go further, it has in its front end a Google voice assistant. At the back end, there is an IBM Watson. So what a nurse does is the nurse speaks into the application, which is on the phone. It could be an iPhone, it could be an Android, it could be anything for that matter. They speak into the iPhone and say, iPhone for that matter. They speak into an iPhone and say, nursing station 001, for example, bed number so-and-so, and patient number so-and-so, I want them transferred. Now these are 3 or 4 voice commands that allow her to complete that action and move the patient from one to the other location. What would the nurse have done in a typical course of a day? The nurse would have gone into the application, logged in with her user credentials, and chosen that ward and chosen that bed and chosen that patient, and then moved it to another person, gone back back and forth a few times, finally clicked save, and then maybe log out and come back to do the next task. Whereas here, the artificial intelligence platform allows her to go in there, talk to the patient right then and next to the bed of the patient, finish that and move on to the next bed adjacent. You don't have to go back to your nursing station to accomplish all these tasks. So look at the kind of productivity that you have engineered in the system. This is just one of the examples. The same thing I could do for medication regime, I could do for doctors and patient appointment scheduling, test results, medical history, so on and so forth. There is so much you can do by way of just enabling them and the stakeholders from not entering data into the system, not having to use the keyboard at all. At this point, I just want to pause for a second and also remind all of us that we are faced in the healthcare sector with the next generation of people who have probably not used a lot of keyboard. I used it. I worked with the PC at the beginning of my career, which had 1.2 meg drive and a 4 meg hard disk, 4 MB hard disk. And there was RAM, I can't remember, I think it is 128 or 256 KB RAM. Today's phones have a lot more than that. And today's generation consumes all that information, not from a PC, not from a laptop. They consume it out of the palm of their hand. I have no idea what it will do to their eyesight when they reach my age, but at least for the time being, I know they are looking to consume information from the palm of their hand using a small device. What is the likelihood that this group of people, when they come into the workforce 5-10 years from now, they will want to work with a PC and a keyboard? The chances are probably not. So you have to start thinking of building technology not for today, but for the generation that is coming up tomorrow, and making sure that you are able to appeal to them so that they interact with the technology in the way that they want, not the way you want. So these are some of the things that we're trying to do. How do you remove the keyboard out of the technology that you're implementing or installing? I'd like to move on to the next part. How do you use these technologies now? If you remember, I spoke of increasing revenue. How do you look at technology to increase revenue and not just manage your cost? One of the things you could do is what I call as customer relationship management. Now, this seems like a fairly easy thing for most people to understand, but it's not really that easy if you see what goes on behind the screens. One of my customers in Singapore, they do a lot of these executive health screening. It's an ambulatory clinic network. They do a lot of these health screening. So they work with corporations and companies and provide them package. So they say, okay, I will come in and, for example, IKEA, right? So this customer goes to IKEA and says, okay, I'll send you my bus, and the bus will have the X-ray machine, the mobile X-ray machines, and the treadmill, and all of that is needed to do an executive health screening. And then based on that, I will send you a report once I come back from there. But guess what happens on the actual day? There are a few people who can't make it because there is a customer escalation, or they have fallen sick, or whatever. Now, can I then send this bus back again another day for those 4 or 5 people? I can't. So what do you want to do is, you want to tell them, okay, never mind, you come to the clinic that is nearest to your house or to the office at a time of your convenience. And when you come in there, I want to be able to make sure that I recognize you are the person against that organization, against that. So suddenly you've seen that the customer, in this case the patient, feels a lot better about having to work with a clinic network provider like this. And that is what allows them to have that level of patient satisfaction that we always talk about, that we want to engineer. And that also gives them higher engagement. You can then, from then on, use the same tool to do other things like, send them patient education materials, remind them, you came 6 months ago and we said you should come back for another checkup, and now is the time, do you want to come for a checkup? You can do a lot of SMS gateway-based messaging. And even SMS gateway-based messaging, I don't know how many people do this here, but it's not just about sending one-way communication to them. You can actually say, confirm your appointment, 1 for yes, 2 for no. You can do all of those things. Or if the patient is getting delayed, you can say there's a 15-minute delay, you please hold on, or you come back later. All these small things can help. And this is how you build that engagement with the patient, with the stakeholder that you're delivering this service to. Sorry. The second point I want to talk about is portals. There are a lot of portals that we talk of, portals that can do self-service, portals that can provide information, portals that send out reports, so on and so forth to the stakeholders. But I was very excited by the portal that I saw in China. They use this messaging platform called WeChat. I don't know if you have known of WeChat. Now, WeChat is like everything that you wanted to do, you can do in the WeChat. Other than eating food out of that WeChat messaging box, you could do pretty much. You can get your appointments, you can make your payments, you can receive your bills, you can receive your reports, you can talk to the doctor, you can talk to the nurse. It's all an online audio, video messaging platform. And suddenly I'm noticing that all the hospitals in China are using the WeChat messaging platform, and not the portal that people like us are building. Suddenly you see you have unified the communication at the point of interaction with the next of the kin or with the patient. So this is another way in which you can bring that value to the stakeholders, and also use that to generate more revenue. You can also do, I was talking to Dr. Bhatia with me, Dr. Singh, sitting with him earlier this morning. Telemedicine is one strong area in which you can bring accessibility, which we discussed earlier on. But it is not just accessibility that we are talking of. This is also about making your assets more productive. Remember, we said if you have only 100 beds, there's only so much of revenue that you can generate. But what about the others? You have nurses, you have allied medical staff. Can you put them to work and manage the wellness and the health of people outside the confines of the hospital, outside the four walls of the facility? This is that powerful tool. There is a hospital I know down south in India, one of our customers, who does about 30,000 or 28,000, I can't remember the number, teleconsults a year. Now you would imagine that, and I asked them, how much do you charge for that? They said, we charge something like 50 or 100 rupees. Now that's not a lot of revenue, right? You wouldn't think of it as a big revenue opportunity, but guess what? They use that as a medium to direct inpatient and outpatient referrals to their facility. Now, all of a sudden, you got a new source of revenue for yourself without having to try much. And you're not delivering a free service, you're actually getting some money for it, although it's not a lot of money, right? So telemedicine is another powerful tool that allows you to deliver on accessibility, but at the same time draw more revenue and draw more patients to the services that you're providing. Referral management is very interesting. This is par for the course in a lot of Western economies. Let me take a few minutes to talk about what this is. As a hospital, you are limited by your physicality, meaning you get a group of patients in the community around you. Typically in India, given the the traffic conditions and all of that, I would say it's about 5 square kilometers, not a whole lot, because that's about the time it takes for a patient to reach the hospital. So if that is the case, can I draw a pool of patients, especially if I'm a multi-specialty hospital, from all over the country? How do I do that? It's very easy if you can use a technology platform to set up a referral network. Your referral network consists of GPs. These are the GPs that are referring cases to you. I won't go into the commercial part of what that relationship is, and I'm sure a lot of the hospitals here know how to manage that. But just imagine if you could, at the end of a period, look at it and say, I got this network of 100 GPs. This one gives me more oncology referrals. This one gives me more physiotherapy. This one gives me ortho. And that one gives me a cardio. These, I believe, are the top 4 in most super specialty hospitals. And then you manage that network. The referral analytics become very good for you. Right? This can be managed out of a platform. And you can also use the same platform so that the referring physician actually gives you some of the case history. They can give you medical records and all of that. And when the patient comes in front of you as a specialist, you not only have the chief complaints, you have their previous medical history and everything else. And again, the process or the care continuum, as we call it, becomes better. So it gives you more revenue. It also gives you one more lever to deliver better patient satisfaction to some of the stakeholders that are coming to your facility. Lastly, I think a lot of hospitals are realizing that because you're serving the community, not just the people who come into your hospital, a lot of hospitals are realizing that there are newer lines of business to be had. But for newer lines of business to be generated off your same platform, you also need to deliver on technology for that. So things like home care, remote patient monitoring, these are all technologies that can actually help you deliver care in the living rooms of the people that you are serving, so that they need to come into the facility only when that is required. For us in Singapore, we actually want to keep the patients at home as far as possible, because elderly patients, especially coming to public hospitals, they don't like it. Our buildings are all 10, 15, 20 floors up. So even if you say that, you come to my hospital and then I'm asking that patient, go up to the 4th floor, from there to the 3rd floor, then come back to another floor for a radiology or whatever, it's not a very pleasant experience for the elderly. So what we want to do is we want to deliver transitional care, we want to deliver step-down care, all in the community, and if possible, within the confines of the living room of the patient themselves. So these also then allow you as a provider to generate more revenue for yourself. So you can see that all these technology solutions are now enabling you to deliver on better patient engagement, more revenue, and thereby get more productivity per asset that you have within the facility, be it public or private provider. Right. I think we've spoken about all of them. I think this is probably my last slide or the second last slide. There is only one more that I want to talk about. How much time do I have? 5 minutes, okay. I do want to keep time. So there is one more point I want to talk about. India does not realize today that you are an aging society. Why do I say this? If you look at the demographics of India, the western states and the southern states have gotten literacy to a level which is past the 80%. Some states like Kerala, I am told it's about 98.2 or 98.7, whatever that number is. Now, as a result of this, there is an automatic effect that you see in those societies. Fertility rates are dropping. For any society to regenerate itself, you are supposed to have 2.1 births against each death. And the fertility rates of these western and southern states, from what I understand, average fertility rates are hovering at about 1.7. You don't realize this. India today has about 100 million people over the age of 65, which are what we officially term as old people. I'll reach there soon. But what will happen is, when that happens, suddenly people who are going to be living up to the age of 80, 85, 90 have in front of them 30, 35 years that the healthcare system has to provide for. You have to look at long-term care. You have to look at chronic illnesses and all of that. So this is a platform that all providers across the world are considering in terms of incorporating into a newer line of business for themselves. How do you manage chronic care? How do you manage the health of a population? How do you manage the people who are getting into that age group of 55, 60 onwards? Because, for example, at the time of independence in Singapore, we had an average longevity of 55 or 61. I can't remember that number. Today it is 85. I have visited nursing homes in Singapore where on the 9th floor there is a gentleman who's 90, 92 years. On the 6th floor, his son is there at 65 years. Because they are nuclear families. This is the problem with India as well. In all the urban cities, you have nuclear families. Look at the state of China. China is even worse because China instituted one-child policy. With one-child policy, you have a husband and a wife. Both of them are single child. Both their parents are there, and at least one surviving grandparent is there. In that pyramid, 4 plus 2, 6, plus 2, 8, plus 1 child, 9, probably there is only one earning member, at best 2. So your support for your family is between 1 to 9 or 1 to 4.5. Either way you look at it. And it's only going to get worse. By 2050, China will have 440 million people over the age of 65. India by then will have 180 million by the same time. And Asia as a whole, because you also have people like Pakistan with 250 million people, Indonesia with 250 million people, you have Thailand and Philippines, all about 80, 100 people, 100 million people. Asia as a whole will have 1.3 million people, 1.3 billion people over the age of 65. So if, as a healthcare provider, you're not thinking of looking at long-term care, aging care, or whatever, now is the time to do that. And remember, at that time, you will have the same problem that you have now, but probably only worse. You will have people who are older, who do not have, you will have nursing shortage of nurses. You'll have so you better look at upskilling them today, getting them to do more value-added tasks, and trying to get into population health management. That's the best thing you can do for the community around you, which means you engage in preventative health and not curative health at that point in time. With that, I have some numbers for you. AI, I don't know what this totals up to. Robotic assisted surgery is 20 billion. Virtual nursing assistant, which I spoke of, is 20 billion. These are the market estimations. We spoke of mobile as not an option, but as a necessary medium of delivery for consumption of information and for interaction for all technologies. So any technology that you invest in, make sure it has a mobile component. That is the key channel for delivery in future. And lastly, blockchain. I think Dr. Gupta spoke of blockchain as well. In blockchain, you look at how do you use blockchain to deliver patient privacy so that the records are stored in disparate blockchain-based registers so that the privacy of the patient can be protected. With that, I'm reminded once again, I'm done with my time. So thank you very much.